Hello, Diaz here, founder and owner of Greenwood Dental. Thank you so much for joining me again for another video. Today we're talking about a concept called pre-medication or prophylactic antibiotics requirements. So again, that's one of the things that we get a lot of pushback on, or patients are not aware of needing to take antibiotics prior to their dental visit, whether that is for their cleaning or for any other invasive procedures. So the pre-medication requirement or the guidelines have changed every 5 years through the American Medical Association. And from my experience is it really depends on the surgeons and depends on your provider too. So I'm going to go over the importance of pre-medication and why it's required by some surgeons and my opinion or how I practice to help you guys figure out or be prepared for your appointment without surprises. So the pre-medication for antibiotics. So if you are a patient that had a heart valve, any joint replacements, a pacemaker, I think it really depends, a heart surgery, even repairs or screws in the foot or the knees or the limbs, a rotated cuff surgery, we cannot touch you for 6 months at least. Now that said, it really depends again on the surgeon. So one of the requirement or the guideline, we cannot touch you, do any invasive procedure for 6 months. The other guideline, you need antibiotics coverage. What that means is you would take a certain dose of antibiotics 1 hour prior to your dental visit. And why is that important? Because if you had surgery that requires placing a foreign body into your body, like titanium screws or plate or a whole new full joint, like a hip joint or a knee joint, that integrates by the body. And that's why we can't touch you for 6 months after you do a follow-up with your doctor. After that, depending on your surgeon, like I said, the guideline changes every 5 years, you would require antibiotics coverage. That is important to have in your bloodstream, since even the cleanings, the regular cleanings, whether 6 months, 3 months, or 4 months cleaning, it will actually disrupt a lot of bacteria. We're flushing, we are stimulating, we are removing, we're introducing a new bloodstream to the area. And that will mix, obviously everything's connected, will mix with the rest of the body. Now, we don't want anything that will contaminate the surgical area. That's why where the antibiotics come into play, to cover you from any inflammation or infection. Otherwise, that will create complications to your surgery. Just simplify it. It's not that straightforward, but I just want to simplify it. So the way we do it in our office, what makes us different than other brands or other offices, we, as usual, we customize it to every single patient, because from my experience, every surgeon is different. I would have 2 patients coming in with knee surgeries after 6 months. One surgeon will tell me, nope, they don't need antibiotics. The other surgeon will tell me, yep, they need antibiotics for a whole year. Some surgeon will say they need antibiotics for the rest of their lives. So what we do, as usual, we customize it depending on the nature of your surgery. So the best thing to do, is my advice, is to contact either your surgeon to let him know that, I skipped my last cleaning and I'm about to go into my dental office. Do I need antibiotics coverage before my cleaning or before my procedure? If they say no, please let us acquire or try to get a release form or something in writing. I will let them email us to let us know that you're good to go. If you require it, what type and how much. Okay, now if you don't want to deal with it, that's okay. Call us and give us your surgeon contacts. We'll be very happy to email them and contact them and talk to them, and we'll get it squared away. So that's pre-med. You know, a lot of you won't even know, you know, a lot of you, the surgeon won't talk about it until we call. Or a lot of you probably they spoke to you about it, but you forgot or you don't understand it. So let us know, and that's why we go through your medical history. We update your medical history every time you come through, because within 6 months a lot could happen, as you have seen in the past, and it's very important for us to make sure that you're safe and make sure your surgery is a success, and you know, make sure that you are taken care of. And that's all about the experience. It's all about you, just like I said in many videos. So that's it about pre-med. If you guys have any questions, please send your comments. Again, please subscribe. This is on our YouTube channel, so you can get notification, because a lot of you I've spoken to, they had no idea you guys had no idea that we had a channel. So we love you. Be safe. Catch you on the next video, and DS out.